Welcome back, everybody. This is Eric here with Iraq Veteran 8888. I've got another special guest with me today. This is Skinny Medic. You've probably seen some content come out before where he and I have talked about medical preparedness and things like that. If you haven't subscribed to Skinny Medic, you need to do it because he's a great dude. He's full of knowledge. He's been a professional paramedic for 13 years, tons of experience, and he's always willing to share that experience with people. So what we're going to be talking about today in this video, we're going to be discussing some things that you might want to stock up on. And what we're referring to, why we would need to stock up, is for a disaster situation, a crap hits the fan situation, a disaster, natural disaster, or man-made disaster, because oftentimes the medical requirements can be the same. And one of the things you're going to run into with medical situations are things, services and goods being disrupted. Yep. A hospital not being able to take any more patients in. You may not be able to get to a hospital for several days, if not several weeks. So in that position, someone who wanted to be well prepared, what would they really want to look at in terms of physical things that they can gather together, but then also like knowledge. What would they really want to go after there? Right.
We talk about crap hits the fan situation. That can be even as simple. When you talk about the natural disasters and all that stuff, and that's appropriate. But even someone losing their job, like the main breadwinner loses their job, it's going to be important to have some medicine stocked up, to have some kids' medicines for your children, stuff like that, to have that stocked up. So we talk about crap hits the fan situation. It can be more than just even the simple things can lead us there.
Well, we take it a lot for granted. A lot of people on a regular basis tend to take regular things for granted, like going to the store and buying, I've got a little bit of a cough. In fact, I've got a little bit of sinus crap going on right now, which is probably why I sound a little weird. But we take for granted being able to go to the store and pick up some medicine and pop it and grab a glass of water and go to bed and sleep it off, and it's no big deal. We take that for granted. But oftentimes, it's really a good idea to make sure that you have some things on. You need to have your own little personal pharmacy kind of on your own accord, so that when those things happen, you're able to circumvent any bad things from going any further and not having to rely on fighting people in line and everybody rushing to try to get water or whatever they're going to do.
And even in a bad situation, EMS is busy as it is.
Yes.
So people, even in a bad situation, people are still going to have heart attacks. People are still going to have strokes. So EMS is already going to be busy, and then on top of this, so you've got to be able to be self-sustained and take care of yourself for a few minutes, and that includes medical supplies.
All right, well, talking about medical supplies, so what would be probably we're talking the bread and butter of being medically prepared. Like, what would somebody really go through the most of in a situation where they can't get to a hospital? Let's say that someone gets shot or wounded, or there's some type of injury that they're really bleeding bad, and you've got to control that bleeding, you've got to change out dressings and everything. So what would be some of the physical things that you would need laying around to help accomplish that task?
I do think that one of the problems is going to be in a crap hits the fan, especially a long term, is infection, sepsis, and things like that. So having good, clean, sterile bandaging is going to be important. Like these packages here, this is a 4x4 box and 5x9. So these are sterile because they're individually packed. So we know they're sterile. The boxes you get that just are a big stack of 4x4s, those are not sterile. And they're fine, but these are sterile. So these are going to be used for after our initial response to get the bleeding controlled, that weeks after we keep the wound clean. This is what this is going to be for. So you can buy this by the box, or you can even buy this by the case. I mean, you can buy this case of this stuff, store it away into a cool, dry, dark place in your closet, things like that, and it's going to be good, and it's not going to go anywhere. And it's things you can use on a daily basis.
Absolutely. So keeping wounds clean, preventing infection, those are kind of some of the most important things. I know, a few years ago, you and I were discussing, okay, well, what happens when you can't go to the doctor and get antibiotics? What then? You know what I mean? Stuff like fish antibiotics, preventing infection. This is fish mox. This is actually some antibiotics that were sent to me by you. We were talking about that, and you said, hey, check these out. These are available at any pet store.
Yep.
Now they say on the bottle, not for human consumption, not for human use. But here's the thing: if you're going to take a round of antibiotics in a crummy situation where you might not be able to get to the hospital for 2 weeks, I think I'd rather take my chances with some fish mox than nothing.
Yeah, and this is definitely one of the situations where I'd recommend, if you could get to a pharmacy, obviously we want to recommend that. But if not, all of the pills had to have an identifier on it. So you can open this up. You can open up a box of amoxicillin. You go to your local pharmacy and get, and it's the same pill. So it's the same identifier that's in there. So if you look that number right there up on Google, it's going to come back with amoxicillin.
Right. And
It doesn't
talking
say
about
fish mox, it says amoxicillin, so it's good.
exactly. So talking about identifying those things, also good reference volumes. We were discussing that earlier, and we're talking crap hits the fan. You can't hop on Google and just look something up.
Right.
You can't, call anybody. Say the cell phone signal's out. No more cell phones or anything for a little while. So having like a literal pocket volume or something, or like we were talking about the book of pills earlier, having a book that can identify things like medication to make sure you're not taking the wrong stuff or anything like
the
that.
physician's desk reference guide.
Sure.
That's a good book to have. It's a good solid book to have. Old nursing books, old first aid books, try to stay somewhat recent with that stuff. But old EMT books, old paramedic books, those are all valuable information, and knowledge is going to be huge.
Absolutely. So, we talked about antibiotics. I mean, because that's usually one of the questions people ask is, what if I get an infection? Well, how am I going to prevent an infection from occurring? How am I going to, keep my immune system healthy? Hell, things like vitamin C, airborne, things that can prevent you from getting sick or getting, the crud or whatever the case may be. We talked a little bit about iodine.
Yep, the betadine there,
Yeah.
The peroxide really kind of got away from that just because it tends to take the good and the bad stuff out of the wound. So this is a little bit better choice. If you were you can buy this in the bottle as well as these wipes right here. You can rub it around the wound to kind of create a border, like a fence around the wound so dust doesn't get in. And then you wrap this up with this 5x9 here and then clean it up, and this is good. Now we change it out, change your wounds out, keep them clean, and we can help prevent infection by doing something as simple as that.
Absolutely. Little things like that people don't think about. And it's easy to get tied up into I need guns, I need ammo, I need food, I need water, I need shelter, sure. But you have to be prepared if something bad occurs and you get hurt. You need to have a way to save yourself and the people around you. So like these little individually packed wipes are a great idea for building that barrier, and as it kind of dries, it forms that.
Right, and you want to let it dry. Some people like blow on us like that. Just let it dry, and it's going to build that protective layer to stop the bad stuff from getting in. And then stuff like this gauze right here is supposed to be airtight, air sealed because it's sterile, but now it's lost that. But you can buy this dirt cheap. I'm talking about pennies for this gauze right here. You throw it in there, and it's good, clean gauze is going to be sanitation is going to be an issue.
Yeah.
So having good, clean material is going to be important.
Well, like we were talking about the betadine, right? Say that you have a jar of betadine or something laying around, and you don't have a wipe or whatever, but you have like a big old jar of it. Taking something like these hemostats here with like a cotton ball, dipping it in there, and then using it to apply ointments and other things. That's also a good thing to have laying around. Cotton balls are great, something like that. And one of the things we spoke about earlier, duct tape.
Yes.
Having duct tape laying around.
I did a video on my channel about making butterfly bandages with duct tape. There's all kind of medical uses for just having good duct tape. And we all have duct tape laying around the garage, on the boat, in the house, things like that. So this is something that's good for multiple uses other than just medical supplies.
I agree. And it's important to be ready and to have these things in bulk. And I think the whole premise of this video is to make sure people understand the types of medical supplies they should probably have in bulk. Obviously, dressings are very important. In case like pressure cuff, for checking blood pressure. Obviously, this is pretty obvious what this would be used for. But then sutures, like we discussed sutures, but talk about the training needs, because some of this stuff is getting advanced. Like, for instance, knowing dosage, like knowing how much of a regimen of antibiotics that somebody needs to take.
Chad was talking, he's allergic to penicillin. So if we give him this, you can find your new partner for a YouTube channel.
Yeah, you might create a problem. You might create a bigger problem than you're solving.
Exactly. So you got to be kind of be careful of this stuff. It does take some education. It does take some training. With the sutures, these are good for larger wounds to keep closed, to prevent infection once you've got the wound clean.
Go ahead and crack one open.
So we can open this up. And this is going to have the round hook in there as well. So then we can, when we go to use our sutures, then we use our hemostatics here. You want to try to just grab it about mid shaft there, and then pull it out. And we are ready to go.
And obviously keeping your body away from it. That's why they come packaged this way, so that it, you know, keeps it clean, everything like that.
And then, you know, just start, use your wrist to work into the wound and try to close it up the best you can to try to prevent infection. You're not really worried about scarring. Like we think about getting sutures now to start from scarring, but now you're trying to prevent infection.
So that's pretty tough.
Yeah, so you would, you know, go into one side of the skin, you're gonna push it together, come out the other side, and then you tie a knot in it and cut it, go on to the next one, and try your best to keep that wound closed.
Absolutely. So see, something like this, you know, it's not rocket science. I mean, basically, if you can tie your shoelaces, you can probably sew somebody up. It's not that big of a deal, but the training needs, and to me, that's the big thing, is the knowledge. Having the books laying around, you may not be able to access the internet. You might not be able to go on Google and just look something up. So having a good, like this, for instance, is like a desktop volume on sutures. Say that I need to read it, like, I don't know, maybe I'm trying to follow directions while, you shouldn't get to that point where you're trying to learn something while you're doing it.
Right, and like this is gonna hurt because we're not gonna have Novocaine to kind of sew someone up, so this is gonna hurt.
But see,
and two, you're making more trauma into the skin by puncturing holes, so you gotta do what you're doing so you don't have to keep poking holes into the same spot.
Right.
So it does take some practice, it does take some training. There again.
See, this little guy sits on the table, so you can open it up and use it as a reference, which is great. So that makes a lot of sense. So it's one of those things. I mean, that we really wanted to make this video to inform people, because a lot of folks have been asking me questions about, hey, what are things you can invest money in that are useful, that you can, you know, buy in bulk and that will make you better as a person? Honestly, literature, you know, medical supplies.
You know, one of the things I liked is the bigger bottles of medicine like this, because you can go to Walmart, there's a 99-cent bin. I found it like in the middle of the night one night. I was going to get some milk. So whenever I go to Walmart, I buy a box of ammo. It's just my rule. And so I came back with milk, a box of ammo, and like 2 bags of medicine. And my wife was like, what the heck are you doing? Like, I found this medicine for 99 cents. So this right here, buy the generic, you don't have to buy the name brand medicine, store it away in a cool, dry, dark place, and this medicine will be good for a long time. And we talk about, you know, over-the-counter medicines as well, you know, your prescription meds. That's a concern too. People who take prescription medications like high blood pressure and things like that. And that's why we had the blood pressure cuff on here, is because if you've got high blood pressure, we probably need to monitor that and keep an eye on it during a crap hits the fan situation.
I mean, think about insulin. That's a scary thing. Certain medications like insulin, there's not really a lot that can be done about that. You know, it's got to be refrigerated. It only, I believe the shelf life of insulin indefinitely is like 45, maybe 60 days max. Right. It has to be manufactured, consumed, and that's it.
You know, there's some herbal treatments, some things like that, but still, like you're in a bad situation, and it's unfortunate, but it's in a bad situation. So even like taking a blood pressure, I mean, that takes some training, takes some practice. You know, they've got the automated blood pressure cuffs, but we found really these can be inaccurate with people moving around, the batteries dying. So with about 10 or 15 minutes of training, you can take a good blood pressure. Another
thing we discussed earlier is the potential of using things like shrink wrap packaging and all of these types of food saver options. Those are great and everything. If you want to buy, like for instance, sutures, you know, if the expiration date is a good way out on them, even past the expiration date, trust me, if it comes down to bleeding out or getting sewed up, you're probably just going to sanitize this and go on with life. You know, even if you just pour alcohol on the dang thing and just sanitize it like you would any other medical instrument in that situation. But also, say you're buying these in bulk, you can actually take these and, you know, grab all your sutures, get them in kind of nice and tight. You can actually package this in Mylar. So you can grab those Mylar bags and package all these things up. And then you add like the, you know, oxygen depleting little like bags to put in there. And then when you seal them, that oxygen depleting bag draws all the air and just makes an airtight seal. All right. The Mylar is keeping light out. It's keeping chemical, any type of chemical or biological type thing out of it, so it's very sanitary. But also you can just take the Mylar packaging, label it, you know, whatever it is.
Keeping it organized.
Yeah, I mean, a lot of times, like these hemostats, you can buy these things dirt cheap, and they're generally pretty good for a lot of different things. You could take and just package a bunch of these in Mylar and write hemostats on them. You know, whatever medical supplies, sutures, bandages. And as long as they were good when you put them in the Mylar, you can extend the expiration date or extend the life of the item by using Mylar as well.
We're talking about expiration dates too. You know, this medicine, there's a lot of people who when the medicine expires, they just throw it away. And the medicine is still good after expiration date. I mean, it may not be as effective, but it's still good. So where, you know, if this is 5 years old, instead of taking 2 ibuprofen, we might take 4. You know, you might take a little bit more, but it's just not as effective. So even post, expiration date, keep your medicines.
Yeah, and also too, there's nothing wrong with talking to your doctor and being honest to him.
Right.
You know, tell your doctor, hey, I want to have a couple of extra EpiPens laying around the house in case there's something really bad goes on and I need adrenaline. Or tell your doctor, hey, I'd like to have 60 days of antibiotics. Now, they're not going to write you a 60-day prescription, but if you're honest with them, chances are they will understand your need as being legitimate, and they can sympathize with your need and make sure you have what you need to be safe and healthy. I mean, that's a doctor's job, is to make sure that you have what you need to be a healthy individual. And if that's something you think you need and you can convince them, and there's that level of honesty there, then there's a pretty solid chance they might go for it.
Right, you
things
just can't
bug bites.
Just don't lie to your doctor. You know?
Exactly, don't lie. Just tell them what you want to do.
But I found that most of them will write that prescription, especially like for high blood pressure medicines like that. They'll write it. Now you're gonna have to pay for it out of pocket because insurance is gonna catch it and see. But it's one of those things, you get that 30, 60, 90-day cushion on your medicine, it's worth it in the long run.
Yep. Things like snake bites. Snake bites. Some people are allergic to wasps and other, winged insects that sting and everything like that. Identify those people in your group and know what their needs are and prepare for it. It's simple. If you need bug bite kits, if you need things like Benadryl laying around for allergic reactions or things like that, antihistamines are excellent. It's a great idea to make sure that you identify those potential needs in your group, in your family, and make sure you prepare for it. And that's on top of the things you want to kind of buy cheap and stack deep, which is what we really mentioned here. So.
But if you get a long-term event, people are going to die. Like there's people, I've seen stuff like, I'm going to do surgery, I'm going to do this, and you're probably not going to do abdominal surgery, chest surgery, open heart surgery. You're not going to do all that stuff. So unfortunately, we can try, but there's going to be a lot of people who die in a real long-term crapshoot.
You have to think about it also. Think about the old days, ancient times. People would die from just a common cut. Because they didn't understand the idea of keeping it clean, and they didn't have as good a medicine as we have now. To, things like antibiotics. You get a scratch, it gets infected. Oh, you got a nasty staph infection. Like you were telling me earlier, staph infection has a 50% mortality rate. Yeah,
like right now inside the United States, if you get diagnosed with being septic or you have sepsis shock, which is allergic reaction, or not allergic reaction, an infection has went super, you have a 50% mortality rate right now in today's health situation. So I think in a grid down situation, it's just going to get a lot worse.
Yeah, so you have to keep that in mind. It's one of those things where it probably won't ever be as bad as you can possibly imagine that it's going to be. Okay, we know that. We know that, there's this fantasy world you have to assume is going to occur, that there's going to be a zombie apocalypse and all this. Is all that going to happen? Probably not. Okay, so you got to boil a little bit of your water. You got to open your windows and relax and drink a little bit of water that you got stored in your basement or something. But ultimately, at the end of the day, things are probably going to be okay, and you have to maintain a positive attitude and just know that having all this stuff is a preventative measure. It's preventative. You want to make sure that if something happens, you can react to it and respond accordingly and save you and your family's lives in the chance that, help can't get there.
Exactly.
So that is the whole premise of this video. Anything else that we might have left out?
I think that's it.
Yeah, it's pretty cut and dry, guys. Medical preparedness is very important. And, with having Skinny Medic here, I thought it was important for us to do this video to make sure you guys understand, the severity of that. I mean, a lot of people, like I said, they will really go hard towards I got guns and ammo and food and water and this and that. And sure, it's great to have water cisterns and all these things that have redundancy.
Right.
I guess that's the best word for it. It's a redundancy in levels of preparation that each of those levels getting broke through to get to you. So you're creating levels of preparation and that redundancy of preparation. So by doing that, you're making yourself hard to kill. That's the whole idea here.
And you can tailor this stuff to your family as well. If you know that you have a child who has asthma, for instance, and you know they need their medicine, well, you just kind of build that up. If you have needs in your family, then you know what they are, then you just build up on that. You don't have to, you just tailor this to your needs, to your family.
Absolutely. So guys, I appreciate you watching today's video. We had a lot of fun making it. I always love talking about preparation. I know we don't really do a lot of like prepper videos and things like that. We generally just don't tackle that content very often because the word gets thrown around a lot. And I think a lot of people don't really understand the true gravity of that word. Preparation, you know, being prepared, being a prepper, you know, we're finding now that that term just doesn't apply to crazy guys in the woods with long beards, okay? Anybody can be a prepper. I mean, have you ever in your life had a situation where you thought, I think I'll go buy a little bit of that and just make sure everything's good to go? Or, hey, I'll make sure I got a few gallons of water laying around. That's how it starts. Being prepared is not being crazy. It's being smart. And, you know, we like the idea of self-preservation and the idea of being, you know, prepared and being a strong, independent individual in society. So that's what these types of videos are geared towards, making sure people can be independent and be healthy in times that we don't ever want to, we don't want to see dark times. No. But if they come, you'll be ready. So that's the whole point. Thank you for watching today's video. We appreciate the support. We have many more videos on the way, and guys, thanks for watching. Make sure you check out Skinny Medic. He's a great dude, very intelligent guy. Tons of this information on his channel if you decide to check it out. Also, a lot of prepping stuff he talks about too. So if you want to dive more into this subject matter we discussed, check out his channel for more content. Thanks for watching. We'll catch you next time.